Bell's palsy. It is a condition that is not fully understood and known by many, but it affects more people than you think. Hollywood celebrities and even local personalities in show business have been affected by this condition. Angelina Jolie once opened up about her struggles with being diagnosed with Bell's palsy, along with other Hollywood celebrities such as George Clooney and Sylvester Stallone. Local Philippine celebrities like Angelo de Leon Rivera had already 2 separate episodes of Bell's palsy. And Bernadette Sembrano, a newscaster, stated that her facial paralysis only started with a simple pain in her ear. With their line of work where they need to be in front of the camera, I think it is very valid to feel worried. In fact, being worried is an understatement. Imagine how hard it would be to wake up one usual morning and find out you suddenly had a disability without you knowing what really caused it. It will scare you. You might think that you had a stroke, but let me tell you it's not. And the good news is that physical therapy can treat this condition. So watch until the end of the video to be educated. Greetings to everyone. This is Dr. Cherry Ann Bangoy, Doctor of Physical Therapy. Today we are going to talk about Bell's palsy, its causes, risk factors, symptoms, how to differentiate it from the facial paralysis caused by stroke, and how physical therapy can help individuals or persons with facial paralysis. But before we proceed, if you're new here in my channel, please click the subscribe and bell button below so you will be updated with my latest videos that will give you free health topics that you and your family can benefit from, free home exercise programs for different musculoskeletal and neuromuscular conditions, and free secrets and tips on managing different conditions that will not only save you your time but your money as well. Bell's palsy is a temporary paralysis and weakness of one side of the face because of the compression or inflammation of the facial nerve. Bell's palsy can happen to anyone at any age, but it commonly affects those between the age of 12 to 40 years old. Males and females are said to be equally at risk, but it has been shown to happen more on pregnant women, for those who have low immune system because of stress and lack of sleep, and for those individuals who already have hypertension, diabetes, and for those persons who have recent viral infection. Do you know that the facial nerve is called the nerve of facial expression? This is because the facial nerve controls the different muscles of your face that allows you to make facial expressions such as anger, fear, pain, and even joy. Since it controls all the muscles in your face, individuals diagnosed with Bell's palsy may also find it difficult to close one eye even during sleeping, thus resulting to dryness of the eye and the need for eye drops that will aid with the lubrication. There would also be drooping in one side of the mouth that would make it difficult to drink water and even eat your food. The paralysis or weakness of different muscles of the face would result to significant facial distortion that can affect the physical and emotional integrity of a person, leading to social, educational, and even occupational handicap. Besides allowing you to move the different muscles of your face, the facial nerve carries nerve impulses in the inner part of your ear, leading to ear pain and intolerance to loud noise at the affected side. Not only that, The facial nerve carries impulses for sensation, resulting to persons diagnosed with Bell's palsy having an altered sense of taste, since the facial nerve allows you to taste and enjoy different foods and drinks on the front part of your tongue. The facial nerve also has involuntary function or autonomic function in the body, such as its effects on the tear glands and salivary glands, resulting to persons diagnosed with Bell's palsy having excessive tearing in one eye or drooling in one side of the mouth. The exact cause of Bell's palsy to date is still unknown, but different medical researchers believe that it is most likely triggered by a past viral infection such as chickenpox and other upper respiratory tract infections. Since facial paralysis and weakness can happen to both Bell's palsy and stroke, it is very important to differentiate between these two diagnoses. How can you then determine facial weakness caused from stroke and that caused by Bell's palsy for you to get proper and timely treatment? Stroke will present with paralysis of the lower face only. Although they have a weak smile, they are able to close their eye tightly and are able to wrinkle their forehead evenly. Facial weakness due to stroke is quick in onset and it typically reaches maximum within seconds to minutes. With Bell's palsy, it causes paralysis or weakness on the half side of the face, including the forehead, the mouth, and the eyes, leading to difficulty closing the eye. The symptoms may develop while the patient is sleeping, and weakness can continually accumulate over hours to days with its maximum severity within the next 3 weeks. It is said that 75% of cases of Bell's palsy recover on its own within the next 3 weeks. However, some individuals may be left with mild to severe facial weakness. Thus, physical therapy is recommended even during the early stage of Bell's palsy to prevent any residual deficits. Besides physical therapy, the following can also be done. Use of steroids within the first 72 hours at the start of the symptoms. Use of eye drops and eye gels to help lubricate the eye. Use of sunglasses for eye protection. Avoidance of air conditioning as much as possible since it tends to dry out the eyes further. Maintaining hydration with a minimum of 6 to 8 glasses of water per day, and the use of eye patch at night to protect the eyes while sleeping. Facial paralysis and physical therapy. Physical therapy is recommended in Bell's palsy. Physical therapists use different treatment protocols to help the functional status of individuals with facial paralysis, with the use of different tools and techniques such as EMG, a tool used to monitor the movement of a muscle, neuromuscular retraining, which is considered an effective method for rehabilitating facial muscles that are unable to move, mind therapy, which aims to promote more balanced and even facial movements and to control twitching of facial muscles, proprioceptive neuromuscular facilitation to improve facial function and reduce facial disability. In addition, facial exercises for Bell's palsy are personalized to a patient. A physical therapist teaches a Bell's palsy patient to perform different facial exercises. Once the patient masters these exercises, he or she can perform them at home as part of regular exercise. Now that you have understood about Bell's palsy and the impact of facial paralysis on an individual, should you know someone with Bell's palsy or weakness in the facial muscles, please feel free to contact any licensed physical therapist near you because they will be able to guide you more appropriately and give you varied treatment options that will help you overcome facial paralysis and give you back the quality of life that you deserve. This is it for this video. Please smash the like button if you find this video helpful. Please share it with your family and friends. And should you have any question regarding Bell's palsy, please comment down below and I will surely get back on you. This is again Doc Cherry. Stay healthy and God bless you.